right, Veronica. We
Hey,
are back with another one. I am excited to be here with you this week. How you doing?
I'm great. How are you?
Hey, I am okay. We are back in our homes, so uh, we're gonna talk about it because I say back in our homes. But welcome everyone to another live episode of the Survey Readiness Podcast. I am your host, Dr. Kirk, and joining me as always is the fabulous co-host, Miss Veronica Caesar, VP of Clinical Reimbursement, the gym consultant herself.
Thanks, Dr. Kurt. Each episode, we're going to break down the regulations that facilities are being cited under, the F tags behind them, and the plan of corrections organizations submit to get back into compliance.
And you already know, Veronica, this episode is no different, right? We have this episode and we have this podcast, and it's dedicated to helping post-acute leaders, the people that are watching this episode, understand survey readiness the way it actually works, not the way we wish it worked, because the way I wish the surveys turn out versus how they actually turn out, it's two different things. So every 2 weeks, we plan to host this podcast, host this episode, and review real CMS findings, talk about the leadership and the compliance failures that are happening, and the survey preparedness myths that we continue to hear over and over, and ultimately lead to facilities getting cited.
Right. And so each episode, we're going to focus on a specific citation. I'll walk through the F tag that we're reviewing today, explain the regulation behind it, and then we'll break down a real plan of correction so leaders understand what surveyors expect to see.
And, at times this podcast is going to be educational. Sometimes we agree, sometimes we disagree, right? How we view things and how we handle this as leaders is what makes us unique to this field, right? But I promise that we always will be honest and grounded in real survey outcomes.
Right. And so if you're an administrator, a compliance officer, especially a compliance officer this week, a director of nursing, owner or regional leader trying to prepare earlier and respond to citations the right way, you guys are in the right place.
And like we said, each week we're going to focus on the F tag, and this week F tag is no different, and the plan of correction is no different. So, Veronica, what is the subject of our F tag this week, as well as our plan of correction?
So this week we're going to talk about F tag 895, and so F tag 895 requires nursing homes to build systems that help organizations do the right thing. It's really about having a compliance and ethics program.
I think that's important. So let's dive into it, right? We are back in our homes. We met last week in Oklahoma. I was the keynote, and I would dare to say you were the closing keynote in the home health track. I didn't know you was going to pull off home health like that. You killed it.
I'm a jack of many trades, master of none.
I was like, when you told me you was doing home health, I said, wait, hold on, what's
No,
you
but
killed it?
you trying to skate past your keynote. The Kirk method was on point. I mean, people were standing up, clapping. You were so modest. And like the Kirk method, if you guys go to his page, he has a download about the Kirk method. I'm actually doing a keynote in about a week and a half, and I have included the Kirk method as a communication tool for long-term care leaders in my keynote. So it's a great method. It was a great keynote. So please give yourself some credit. I mean, you were amazing.
I appreciate it. And, I thank you to Leading Age Oklahoma for having me back this year. Again, I'll be back there next year. I don't know in what capacity, but I will be back there next year. It was nice because I was able to show Survey Guard, which was nice, right? Because this was the first time that I'd taken Survey Guard out in public. So I think since I brought up Survey Guard, I'd like to thank our sponsors for actually assisting us with this episode, because we will be nothing without our sponsors. Let me flash them on the screen. We have 3 keynote sponsors of every podcast, right? Survey Guard, which is the post-acute care compliance platform of choice, which has everything you need to be compliant. Of course, my consulting company, SMK Medical, which we're a full-service healthcare consulting company, help with MDS, mock survey, survey preparedness, QAPI, everything in between. And if you need education and training, we got my girl, Veronica Caesar's company, Gym Healthcare and Consulting. So yes. Shout out to our sponsors that make this episode possible. Really, really, really appreciate it. Next week, I will be in Florida at a pack-in at another booth. Where are you going to be coming up?
I will be at Iowa Healthcare in Des Moines, Iowa, suburb of Des Moines, but that'll be on the 25th. I'll be doing a keynote. Okay. Also have some breakout sessions later that day, the 25th, and as well as the 26th.
Wow, wow, wow. I know they're grateful to have you down there, doing what you do. Over the last 2 weeks, there were no new QSO memos that came out. There was nothing new that came out. Thank you, because
They hit us with the well bound, right? Yes.
we tired of it. So, we did meet somebody, and they remain nameless. They say, DJ, get to the point. You talk about leadership a lot, which yes is my focus, but they said we want to talk about compliance. We want to know how we need to remain survey ready and what we need to do to remain survey ready. So, I wanna get right to it and review the plan of correction of the week. So, Veronica, take us to the plan of correction for the week. Let's talk about it.
So the F tag that we're gonna start with, though, let's start with the F tag.
Start with the F tag. Okay.
Start with the
Let me bring it up on the screen real quick.
They kind of go hand in hand this week, and we did have some listeners stop us in Oklahoma, and they want more of our F tag, our 2567. We kind of got off track a little bit last episode, so we did have some listeners.
We had some feedback. say, what y'all doing? You supposed to be just strictly focused on. Let me get the share tab correctly, because it's not. I wanted to share the whole screen and nothing but the screen. But yeah, they was like, yeah, you need to make sure you doing it the right way. So this week, as you talked about, we're speaking on F 895, and that's the F tag we're talking about. I think it's very important. So walk us through this. Then I got a little presentation I can show as well.
Okay, so FTAG 895, again, is having a compliance and ethics program. And so, again, beyond the binder. So CMS definitely outlines several core elements that must exist in a facility's compliance program. So that includes written standards and policies. And so we have to have clear written standards of conduct and compliance policies that guide our staff behavior. So things like resident rights, of course, abuse prevention, documentation standards, as well as regulatory compliance. We also have to have designated compliance leadership. So your facility must designate a compliance officer, a compliance committee. And so these are the people responsible for the oversight of your compliance program and monitoring of risk areas. You also have to have an effective training and education. So your staff must receive education on compliance and ethics expectations. So that includes in your new employee orientation, ongoing compliance training, education on reporting concerns. And so we're going to see in the plan of correction how some gaps in those areas cause the facility to be cited. There also needs to be open lines of communications. And so facilities must provide safe ways for employees to report concerns. So these include anonymous reporting, non-retaliation policies, and a clear escalation process. Monitoring and auditing is also included as part of this. So your facility must actively monitor compliance risks such as billing accuracy, documentation practices, and quality reporting. Okay. And so also, if you have a facility that has 5 or more facilities, you also have to have an additional program structure, which has a designated compliance officer, as well as your designated compliance liaisons at each facility. And so again, not another person who's doing compliance as a part of
their job. It needs to be.
They're doing
and that's
right.
That's what we do, right? So I'm VP of Ops, and I'm the compliance officer, and I'm X, Y, and Z. So I want to break this down because, of course, as always, we come with the facts. We come with the education material. So if you know me, I am the owner of Survey Guard. I hate binders. That's the old way we do it. Static policies in a binder, and we expect staff to know exactly what it is and how it is. What CMS is saying, and once again, this is not a new regulation, so please don't think this is new at all. What they are saying is F895 must show active monitoring, right? This is a live program. We're talking about survey readiness, right? It needs to be enforced to prevent, detect, and correct violations while actively promoting quality care. Let's focus on that, right? Actively promoting quality care. So when we look at this right here, right, there are 8 core components, 7 core components, 8 core components, right? Establish rating standards. We know we need this, right? Assign high-level oversight. Can't be your director of nursing. I've seen it where a compliance officer for a company, and this was a company with 12 nurse homes, was inside of a building as the active staff development nurse.
Wow.
How are you the staff development nurse and you're the compliant. No, you're not, right? So allocate sufficient resources, meaning this person must have the budget to do education and training that's appropriate. I think that's important because just because you had a title, if you can't make changes, what are we really doing?
Right.
Exercise due care and delegation, which means you're able to do the investigation and be impartial. Communicate and train staff system wide. Implement anonymous reporting. This is where it goes wrong. It's not just a number to your cell phone, right? A lot of times companies will outsource this to another company who can gather that feedback. So anonymous means they don't have to leave their name number. They should be able to report. And in theory, you shouldn't be able to tell who it is, right? But if they're calling your cell phone number, you're screening the call, you're going back and looking at the phone number, that's not anonymous, right? Enforce via disciplinary mechanisms, and then recognize rapidly and modify the program, right? So respond rapidly and modify the program. This is a compliance system. This is a compliance program here. It's not stagnant as we've just talked about, right? So when we talk about how we vet these people that we are hiring and ensuring that we're hiring the right people, which is a part of the regulations, right? It starts at the top, background check, employee histories, OIG exclusion list, and then we clear these leaders to come into our organization. This is where it starts. Leadership cannot turn a blind eye to the history of the people, right? So how many times, and Veronica, to be honest now, I know I've been, where I went to an interview and they asked me to start yesterday. Right. I know I've been at jobs where I went to an interview and they just put me in and I started
before the orientation. We don't have orientation till Wednesday, but you could come on Monday and get started, right?
We're going to get cited. That's not so. Our job is to prepare you for survey readiness, right? So when you look at this high level PowerPoint that we made here, right, we want you to make sure you're getting these people through. Let's talk about this anonymous reporting structure. How have you seen, right? When we say anonymous, that means you should be able to jump over, right? Right now, and we can talk about that plan of correction you saw, fear retaliation.
Yes, if you don't have an anonymous reporting structure, this facility, the plan of correction that we're going to review, when they got cited under F897, several of the staff members that were interviewed related to an elopement or some other type of sentinel event stated to the surveyors that they were afraid of retaliation. And so they did not report certain things. And so that is a big red flag. If you do not have an anonymous reporting structure for your staff to use and that they know how to use, they've been trained, they've been in service, we have postings where they can reach this anonymous tip line, then that is a problem. And you need to address that right away. First thing Monday morning.
And so we talk about the surveyor trap, what I have here on the screen. They will ask your staff, how do you report a complaint anonymously? And if your staff can't answer that, that's going to be a citation if they don't know how. And so let's be clear, right? These are not new regulations. Well, we picked this F tag. This is not new for 26, not for 25, right? This has been a tag that has been there. It is part of the phase 3 implementation years ago. At this point, 6-7 years ago, if we're being honest.
Yes,
this is just a tag
element of a compliance program is open communication. Like that's at the very core, right? And so the moment your staff feel unsafe speaking up, your compliance program has already failed. Like game over.
And you talked about it, right? This impacts every facility, but definitely our facilities are 5 and more. I think a lot of facilities try to operate as lean as they can, but they miss these elements such as this one right here, where you have to have annual training. You have to have a designated compliance officer with their major responsibility is compliance, right? Reports directly to the governing body. Let's talk about that. Not general counsel, not the CFF, not the CFO, not the CEO or the COO. The governing body. Yes. The governing body. I was working with a builder, and the way that they had the compliance structure reported set up is everything went through to the general counsel first, then it filtered back to the compliance officer, and said, well, that's not how we do things. Oh, wow. This was recently. That's not how we do things, right? So you have to make sure that your compliance liaison is active, available, and impartial, right? Mm-hmm. I think it's hard for some organizations to be impartial. You have to investigate every complaint, right? We got so many different laws, Stark laws and anti-kickback laws. You have to treat every concern as is valid.
Right. And
So
impartiality is the key, because the purpose of a compliance program is not to protect the organization from regulators per se, right? It's
yep.
really actually to protect the residents by ensuring the truth is reported, investigated, and ultimately addressed, so that we don't have any other issues moving forward.
And like we said, right, the binder's just the first step in it, right? But it's just the first step, and it's a step that I want you to avoid is that binder, because nobody has time to go look at that binder, right? How are we training staff? Did we embed this in new hire orientation? Is we doing this in annual orientation? How are we quizzing staff? How are we checking staff? Because from a surveyor lens, they're going to check and they're going to see this, right? And they're going to have questions, and you should be able to answer those questions, right? They're gonna look, especially if we got 5 or more buildings, they can ask, like, okay, what compliance concerns have you had? What's your documentation process? How do you validate these concerns? How do you verify the history and the background of your leadership, right? And the designees, provide documentation of your annual review compliance program. That means training, and that means your annual review of the program, how
Yes.
effective it is.
Mhm.
Two different
Right.
things. Two different things. So I think buildings have to come prepared for that. We go over a lot more into this, and we'll make this PowerPoint available to people. We should probably do an ebook to this, if I'm being honest.
Okay.
Right?
We
We
got to
should
give people
definitely.
what they want, DJ. We got to give them what they want.
So walk us through what you're seeing on this screen, because I think this is a powerful, powerful screen. Walk us through this.
So literally these three tags go hand in hand, right? And so when you look at F895, what we're talking about today, compliance and ethics, it goes hand in hand with your QAPI committee. And so that could be tagged under F868. So when we're auditing the data, we should be talking about these things in our monthly QAPI, any areas that we need to be addressed, right? And so then when we find those systemic vulnerabilities, we're going to update our facility assessment. That's also a requirement. And so that is falling under F838, right? The facility assessment. Facility assessment also is what we use to develop a competency and training program. And so then if we understand that our staff are lacking in some of our compliance and ethics, or they don't have the understanding that they need, then we need to beef up our training program. And so that's all addressed in F838 facility assessment. Then we go right back around. It dictates the resources for the annual program review. So it keeps going into that loop, right? And so all of these go hand in hand. So
I think I might have lost Veronica. Let's see if she can come back in. I feel like I've lost Veronica. This is live. The weather. It could be my internet here in Hawaii. We are in an actual monsoon as we speak. So
oh no, am
did
I
I lose
back?
you?
Can you hear
Yeah,
me?
one of us lost. We're in a monsoon here in Hawaii and we live. So it's literally a monsoon. I'm watching. I
Can you
can't see
hear
nothing in
me?
front of me. I can hear you. Can you hear me?
Yes.
Yeah. So we're in a live monsoon right now here in Hawaii. So
And it's
that's
75 degrees and sunny here in Dallas, Texas.
yeah, it's a live monsoon. But what you were saying is true, right? Is that we have these issues, and everything should run through your QAPI and your facility assessment. And frankly, that's if we want to get real, it's not an ad. That's what Survey Guard is here for, right? We have the
Right.
facility assessment QAPI program built in. It's compliance officer's dream. I digress. Let's switch over to the actual plan of correction that you want to review. Talk to us about that plan of correction. Hold on, let me. I missed doing my thing. I should have did this. We got so many bells and whistles we missed, but let's talk about that plan of correction.
So this happened. This was cited in February of 2025. So last year, pretty recent. But at the core of this was they had a resident that eloped a couple months before the actual complaint survey. And so when the surveyors entered the facility to kind of investigate, there were conflicting information between the self-report and the documentation versus the incident report versus staff reports, right? And so a resident eloped and walked to a gas station across the street. The incident was not documented as an elopement. So the incident was not documented as an elopement, in the facility incident logs. And so the facility leadership called it a near miss. And then multiple staff reported retaliation for speaking up. They said that the staff said the administration told them to keep their statement short and sweet. And the resident's daughter was also not notified of this elopement, right? And so surveyors concluded that the compliance program failed to ensure ethical conduct and reporting practices.
And so what you just said, right? When you just said, I'm gonna pull up this 2567. I was pulling it up. I apologize for not having it ready. Where is my Chrome tab? 8685. Here it is. Yep, this is this one right here. So when you were talking about it, there we go. Bring you back here, show on the screen. Make this bigger. Switch to this screen here. Oh, they're still not gonna be able to see it because I didn't download it. Okay, well, this is the plan of correction that we have right here. I'm going to switch back to us while I get that together. Here's the deal. When we cohort staff, or if you have cohort staff, you're possibly placing yourself at liability, because here's what's going to happen. When the state investigates and they speak with the staff, you can't control what the staff is going to say. You can control the narrative when you're intimidating that staff, right? But you can't control that narrative when they're sitting on that stand or they're sitting in front of the surveyor, right? So the surveyor is going to document exactly word for word what that staff member has stated. And in that particular case, they didn't have a compliance system in place.
Right. And actually, I'm looking at the 2567, and it said the director of nursing confirmed she was the risk manager. She was informed that the staff had expressed information regarding an elopement that occurred the last few months of 2024, but then she stated she was not aware of any elopements.
You know, and so here's the problem. How you DON, but you're not aware of elopements, but it's documented. I know sometimes you try to get creative with wording, right? A near miss, but let's look at the definition of elopement, and I can pull it up. But ultimately, if you lose sight of that resident, they're not out of visual sight, and they leave your facility, it can be considered an elopement. I just did a whole keynote presentation on that, right? A whole keynote in the state of Oklahoma about it. You got to understand, when we call it elopement, there are specific words from CMS that determines what's an elopement versus what's AMA. To be clear, a resident has a right to leave, and that can be considered AMA versus an elopement. And how I would clarify, without even looking at the rules and regs, if a patient is leaving with no intending of returning to that facility, that is an AMA. If that patient is eloping, meaning they left and they come back, that is an elopement, right? So I think we have to look at, and it's all about what the resident is saying, with the guard, especially if there's a guardian. It's an elopement all day. They didn't leave AMA, right? They didn't. But if they're their own person, that's where it gets a little dicey, right? And their BIM score matters in this situation. But when it goes back to this ethics program, we could talk about just the ethical conversation that we need to have about telling the staff what to say in the incident report and how to document in the patient's chart. Right. Ethically, not even a compliance program. We should not be guiding a person's words that they should be putting in the chart. They should be documenting what they see, and they should be documenting what they heard, right? When we tell them to change the way that they speak, or the way that, or the description of the situation, I think we're taking the onus and putting it on ourselves. What do you think? Did I lose you again, Veronica? I think I lost her again. See, it's the monsoon. She's saying it's 80 degrees out in Texas, but it's probably my monsoon. But I think that's something that we need to consider and something that we need to think about. She will pop back in. I've dealt with elopements, and you're back.
Am I here? Okay. I can still hear you, so I don't know what's going on.
Yep. So I've dealt with elopements, and they are not fun. I wasn't tagged. I did get an IJ, and it was for 689. We talk about it, and I'm very open about it. 689. It had nothing to do with my compliance program, because I handled it with grace, and I handled it with dignity. So when we talk about that compliance program, it goes back, and I want to pull up a few additional slides, because all of this ties together. I want to pull up a few additional slides into that PowerPoint I was just showing you. Let me pull it back up really quickly. Pull up a few additional slides here, because what you were talking about with that triangle, right? The which we're talking about, the F895 going over the 868, which is QAPI, and then finishing up and rounding over with the final 838, which is facility assessment. So I think
Mm-hmm.
we just have to think about that and be ready for it. Investigators will find it. They know how to find it. They're not new to this. They know how to sniff out if an organization is being dishonest. And frankly, when an organization is being dishonest, it really just gives the rest of the organizations that are doing what they need to do, frankly, a bad name and a bad rep. So let me show on screen really quickly. Hide this stream here. Remove this one. Makes this bigger because I think this picture said a lot, right? And
Right.
thank you to the viewers who are watching. We really appreciate the love and support here at the Survey Readiness Podcast. But ultimately, this screen speaks a lot to what we're saying. So let's talk about the action plan, right? As we get ready to wrap this up, here's your actions plan. Audit to make sure you have an anonymous hotline. Call the number yourself as an administrator, as a regional, as a VP. Does it actually work? Is it in order? Did we pay the bill? Does it route correctly? You know I'm telling the truth.
Right.
You know I'm telling the truth. You know facilities have sometimes this may be a bill that is the first to be cut.
Yeah.
We then need to verify the 5, or if we have 5 facilities, verify that we have an active compliance officer with a job description whose primary role is to focus on compliance, who bypasses the COO and the CFO and reports directly to the governing body. Ensure that you're integrated it into your QAPI plan, and then prep the front line, right?
Yes.
Host 5-minute micro trainings, right? What does that look from your perspective, right? What's your thoughts on the training? Should it be just that little notebook or that binder at the desk? What do they need to do to make sure it's happening?
I'm gonna go and interview staff, right? I'm going to go maybe make an assignment. You go to certain units, certain days of the week. I'm gonna ask that frontline staff. I'm gonna pull a housekeeper aside and say, "Hey, do you know how to report any issues? Do you know the reporting line? Do you know the information?" I'm going to go to wherever I say that this is supposed to be posted at, whether it's at the break room, whether it's in the time at the time clock. I'm going to visually verify that the reporting poster or information is there, right? Because we assume a lot of things. You have some administrators who haven't been into the employee break room ever
Facts.
or in months, and you don't know that they've ripped down every required posting in the break room, or it's old and outdated. It has food thrown on it. We can't see the number. It may be an old number from a company that we used to use. So those are the steps that I'm going to take to make sure that our frontline staff have the accurate information.
I love it. I love it. I love it. I appreciate that. And here's this: compliance is what you not. It's compliance is what you document in a binder, right? That's compliance. You're compliant on paper, but ethics is what your staff does on the floor when you aren't looking. Let's go back to that plan of correction. You guide staff to where they need to go. We got a problem. So when we talk about this particular F tag F897, it demands both. It demands compliance and it demands ethics. So, I appreciate our sponsors as always for just, being there to support us and sponsoring us so that we can do this podcast. So I flashed them there up on the screen again. I thank everyone for really watching. Veronica, what's our compliance tip of the day? What you gonna leave us with? And we hope this podcast for our viewers who have watched has met their needs from a survey readiness perspective, right? Because we've heard. Yes. So, Veronica, talk to me. What's your compliance tip of the day?
I'm gonna leave you with this, right? You want your staff to feel safe reporting problems, right? Because if staff don't feel safe reporting problems, then leadership won't hear about them. We can't fix the problems. But then you know who's going to hear about them? The surveyors, right? The surveyors are going to hear about it. And you do not want the surveyors being that first person to hear about it. And so we talk about communication with frontline staff a lot on these because, again, communication with frontline staff, your residents, their families, because when surveyors come in, you don't want them to be that first person to feel like they're being heard, right? You don't want a surveyor to come interview a resident, a family member, a staff member, and now they like lights, camera, action. Nobody's heard me, nobody's listened to me, and now I'm going to just spill everything. So just making sure you have a culture of safety and communication.
I appreciate it. And we did get a comment. Thank you, Reg. I know exactly who Reg is. I appreciate you for coming in and watching us live on the Survey Readiness Podcast. Veronica, how can they reach you?
They can reach me at Veronica at veronicacaesar.com.
Hey, that's what's up. And here's the deal, right? As we wrap up, we want to thank you for spending time with us on the Survey Readiness Podcast. This podcast is in production collaboration with SMK Medical Survey Guard and Jim Healthcare Consultant. We are organizations that focus in on strengthening leadership, compliance, and systems for survey readiness across the post-acute care industry. The views and opinions expressed on this podcast are for educational purposes only and do not constitute legal or regulatory advice. Regulations change on a daily with CMS, right? Survey interpretations vary, and our listeners should consult appropriate professionals when making operational or compliance decisions. If this episode helped you think differently or prepare earlier, subscribe, share, like, hit that button, do everything to do to follow us so you never miss an episode. You can always follow us on YouTube at the Survey Readiness Podcast. We are on iHeart, Alexa, everywhere that you are, we are there. Simply search the Survey Readiness Podcast. If you want to follow me, I'm on TikTok at your healthcare consultant. Until next time, stay survey ready.